I know you've heard it. The moment you hear the word cancer, the mind jumps straight to the end. When we assume a medical diagnosis is absolute, we stop looking for answers. And in that vacuum of information, panic takes over. In Nigeria, this specific fear dictates how thousands of people navigate their healthcare. It stops them from visiting the clinic, from asking critical questions and getting routine screenings. People will actively decide they would rather not know. The logic is tragic but simple. If the outcome is already sealed, why put yourself through the process of finding out? But skipping the test does not stop the disease. It only guarantees that by the time you're forced to seek help, the symptoms are severe and the window for treatment has closed. This psychological myth claims more lives in Nigeria than the biological disease itself. The fear of the diagnosis creates the mortality rate. To dismantle that fear, we have to look at what cancer actually is. It is not a monolithic threat. It is an umbrella term for over 200 distinct diseases. Each of those diseases behave differently and respond to medicine differently. Calling all cancer an automatic death sentence is as inaccurate as saying every infection is entirely untreatable. This chart shows 5-year survival rates for common cancer: thyroid over 98%, breast over 90%, prostate close to 100%, expanding to testicular, cervical, and bowel cancer. They all hit 90% or higher. But this rate requires 2 words: detected early. The deciding factor separating a highly treatable condition from a fatal one is not always the specific type of tumor. Often, it comes down entirely to timing at stage 1. Where the tumor is small and strictly localized, it is at its most vulnerable to modern medicine. At stage 4, the disease has spread to distant organs, severely limiting what doctors can do. The biological bridge from a highly treatable stage 1 to a highly difficult stage 4 is almost without exception the unchecked passage of time. Stage 1 is typically found by someone who proactively went in for a routine screening. Stage 4 is regularly found by someone who let the myth delay their action. The distribution curve of cancer diagnosis in Nigeria is heavily skewed right. The vast majority present as stage 3 or stage 4. This last stage spike stems from fear-induced delay. The typical patient only seeks help when pain becomes unbearable. Patients who arrive at the clinic at stage 4 had the exact same biological potential to be saved as stage 1. The fatalism itself is what cost them those critical months. Routine screenings offer the highest chance of survival. In modern oncology, you must go when you feel perfectly healthy, long before the first symptoms appears. For women, that means maintaining a strict schedule of routine, cervical screening and breast checks. For men, it means initiating routine prostate checks as soon as you turn 40. And for everyone, it requires paying close attention to your body. Unexplained weight loss, persistent lump, or unexpected bleeding need to be reported to a doctor immediately. You have to mentally untangle the fear of the disease from your timeline. Waiting does not offer protection. It just burns through your best opportunities. A clinic visit maximizes your medical option and keeps you in control of your health. Knowledge is a primary mechanism of survival. Early detection transforms a positive test into a manageable medical plan at this stage. Survival is a matter of protocol, not luck. Cancer is not always fatal, but believing that it is makes it far more likely to be. Know the truth, schedule your screening, and recognize the cancer as early as possible.